Today we will study like a brief explanation for the most common congenital infection. Okay, the first one is toxoplasmosis. Where's the highlighter? Let me zoom in. Okay, you might see things written in Arabic. This is for Arabic speakers. Okay, don't bother. So toxoplasmosis, it's a triad of hydrosyphilis, okay, chorioretinitis, plus, which is the most important information here, that the patient will have, or the infant, the fetus will have intracranial calcification. It's called intracranial. Throughout the brain, you will have calcification, okay, throughout the brain, just like this. Calcifications seen on CT scan are randomly distributed throughout the brain parenchyma. This is the most important information about toxoplasmosis when he mentioned in the case that he's having intracranial calcification. Okay, it's not specific to one area, so we should think about toxoplasmosis. The second one, cytomegalovirus. Cytomegalovirus presents with petechial rash, plus, which is the most important here also, it's called periventricular calcification. So if this is the ventricle, the calcifications will be only around the ventricle, which is the opposite of toxoplasmosis, which will be throughout the brain. So this is only periventricular, around the ventricles. Treatment, postpartum ganciclovir. So we will give the mom after delivery ganciclovir. Another information with the herpes simplex virus. Herpes simplex virus will cause skin, eye, mouth infections and life-threatening CNS and systemic infection. Treatment for herpes simplex is acyclovir. If we found a visible lesion on the vagina during delivery, we will stop the normal vaginal delivery and we will perform a C-section. If there is a visible lesion, visible vesicles of herpes simplex virus on the vagina, we should never do a normal vaginal delivery. We will stop the vaginal delivery and we will do a C-section. This is very important information with the herpes simplex virus. Okay? The third infection is, or the fourth infection is syphilis. Syphilis will present with maculopapular rash, lymphadenopathy, hepatomegaly, and the keyword here is called snuffles, mucopurulent rhinitis. I will advise you to look it up. Write snuffles or syphilis on Google and you will see a picture that you'll never forget. Then he will have osteitis. Okay, patient with syphilis, they will have a Hutchinson, what's called the Hutchinson triad. Hutchinson triad, which is the first one, teeth. Hutchinson teeth, which is notched teeth. Google it up. You will find a picture for this. Plus interstitial keratitis. So I have a problem with the eye, cornea, deafness. So a problem with the teeth, problem with the eye, and he's deaf. Problem with hearing. This is called Hutchinson triad for syphilis. Okay. Now let's go for rubella. Rubella is composed for purpuric blueberry muffin rash. Blueberry muffin rash. Patient presents with mental retardation, hearing loss, cataract, and the most important thing, which is called patent ductus arteriosus, BDA. So he is having mental retardation, he is deaf, blind, and he is having congenital heart problem, plus the rash. The last infection that we are studying here is called HIV. Patient in utero, like how the HIV will be transmitted to the infant in utero while the baby is still in the uterus, delivery, during delivery, because there will be mixing of the maternal blood with the fetal blood, and during lactation. Symptoms present with a failure to thrive, severe bacterial infection, low immunity. How to prevent it? We will give azathioprine in a pregnant woman with HIV. and we will perform a C-section if the viral load was more than 1000. Okay, this is a very important information. So if we knew that the mom is HIV positive, we should give her azathioprine. But if the viral load was more than 1000, we will perform a C-section during delivery. More than 1000, we shouldn't do a vaginal delivery. We will perform a C-section. And this is a summary of the most important congenital infection you can find during the exam. Thank you for watching. See you in the next video. Bye bye.